Hello and welcome back to Bunny 101. This is part 4 in our series during Bunnyfest 2021. My name is Colleen and I am an educator with the San Diego House Rabbit Society, and I've been volunteering for about 6 years. Today we're going to go over some at-home grooming best practices, some easy to follow home health checks for when you might be concerned about kind of what's going on with your bunny health wise, and then some rabbit handling as well so that you're comfortable when you do need to pick up and hold your rabbit. All right, next slide, please. So we're going to start out with some special features that are unique to rabbits. So rabbits, their ears, which they're known for, oh, this is not a real bunny, by the way, but their ears help them regulate their body temperature. So actually, when it comes time to do their at-home health check, you can gauge kind of if your rabbit's temperature seems to be high or low compared to their healthy temperature by feeling their ears. You can also help them cool down by applying a damp cloth. So it's really great to just pay attention to what your rabbit's ears feel like. Their ears also move independently of each other. So even if you've got a little lop bunny, they can still pop that ear up, and that helps them hear in surround sound so that they're going to be able to detect any sorts of strange noises in their environment. Rabbits also have eyes on the side of their head. They give excellent side eye, and they also have great peripheral vision. So your rabbit's going to be able to see almost everywhere except for directly in front of them and directly behind them. So you do want to be careful, especially when your rabbit is getting used to you, not to approach them by just starting by bopping them on the nose or petting them on their back or shoulders. You want to approach them in a way that they're able to see you with their peripheral vision. And then rabbits also have a highly developed sense of smell, just like many of their other senses. And their little nose is going to be going sniffing in any new environment or in a new, maybe stressful situation. They're just going to be sniffing to make sure they know what's going on. And also, as prey animals, they are very protective of their home. So they'll often want to mark their territory. And they do that with scent glands that are by their anus and under their chin. So they can mark their territory by leaving their droppings, maybe in corners of the home, or by rubbing their chin on things that they like. And that could be just their, their litter box, their pellet bowl, or maybe even, your stuff or you. And then finally, rabbits have very muscular hindquarters that are built for speed. So as prey animals, they're able to escape if they need to. That also means, though, that their hindquarters are pretty weighty and dense, and so they need to be supported. And we'll talk about that more when we go over how to handle your rabbits. Okay, next slide, please. Let's start with some good at-home grooming habits. We did have another session that goes a little bit more in depth into grooming best practices. So I would encourage you to register for that session so that you can purchase the recording. It's a really great session, and it also talks about instances when you might need to talk to your vet for some assistance with some more specific grooming needs. But for now, we're going to go over some basics. So something you want to keep in mind is that rabbits cannot regurgitate hairballs. They are not like cats in that way. Just like a rabbit isn't going to land on their feet like a cat does if they fall. Rabbits cannot cough up hairballs, so they need some help from us. They do have molting or shedding seasons about 4 times a year, usually directly preceding our calendar season changes. So for example, in the summertime, your bunny's going to shed a lot during the springtime to prepare for the warmer days of summer because, of course, they have a fur coat all the time. So the ways that you can help them just on a daily basis is to pet them regularly day to day, and that's going to help to remove some of that loose hair that just kind of sits on top. And then lightly brush them or comb them depending on their, hair length. Longer haired rabbits are going to need to be combed pretty much every day to avoid tangles. But your medium hair, short hair rabbits are going to probably need to be combed or brushed about once a week or every other week, depending on whether they're heading into a molting season, in which case they'd need to be groomed up to, every day. So what I recommend is that if you have a bunny with that medium to short hair, you get yourself one of these combs. I'm going to do this like influencer YouTube thing just so that you can see what those little silicone grippers are. It's just a band of silicone. And what you do is, this little stuffed bunny is going to help me. You're going to comb them at an angle. You don't want to comb them straight down where the teeth are going to maybe scratch their skin. You're going to comb them at an angle, and that's going to help lift out and grip some of those under hairs that are already shedding out but may be stuck. Because if you're not able to get those hairs out, your bunny could then groom them out themselves later and get a blockage in their digestive system, or they could just build up and turn into painful matted hair. So you do want to help them out with that. If you're new to grooming, or maybe you have a younger person in your home who is also new to grooming, then I recommend using these little silicone massage style grooming tools. And you'll see one there in a picture near the bottom of the screen. These are great because they're all soft, so they're not going to have the little pointy teeth like a comb will have. And you can, use it right there, just directly on your bunny. And they're a little bit gentler. So I have a bunny in my home who has very sensitive skin, and she does not like the comb because it tugs on her hair. She doesn't mind this though. So if you have a bunny with a similar issue, this might be a good idea for you. As for these types of combs where they're like the little bristles, I use these actually for removing hair from carpet. They don't tend to be very effective for rabbits' coats, but they're great to have around for their carpet, their blankets, etc. Okay, so we've talked about grooming, brushing, the molting. Let's also talk about nail trims. So rabbits are natural diggers. They like to scratch things, and that tends to keep their nails fairly worn down. But domestic rabbits, since they live indoors, they're going to need a little bit of help. And that's usually going to be about every 6 to 8 weeks that they're going to need help with a nail trim. You can get that done at the SDHRS bunny store by appointment if your rabbit is vaccinated for RHDV2 already, or you can have your vet do it. Usually your vet will offer at your bunny's wellness exam. But you might want to try to do this at home, and it's always good to know how. So I recommend just a very simple nail trimmer, not anything that's spring loaded, because then it's a little bit easier to use it, because you're just going to want to look for the quick and then trim below that. And you can do a little 1, 2, 3 tap. And if your bunny doesn't react, like they don't pull back, they don't seem afraid, then it's less likely that you've hit the quick. If you do have a bunny who has darker hair and darker nails, those nails do tend to be more opaque than the lighter colored nails. So I recommend getting a little flashlight so you can put it up against the quick, and it's a lot easier to see where the quick ends and the nail begins, and vice versa. Then also, while you are doing your grooming, it's a great time to get ready for their health check, which we're going to talk about in a little bit. But you do want to make sure that you're able to take a look at their eyes, maybe take a peek in their ears, check their nose and their groin. Some people will put their bunnies on their back while they trim their nails. I don't tend to do that, but I do while I'm grooming them. I'll just prop them up just so I can take a look and see, all right, do you have any buildup? Sometimes bunnies will get buildup of poop or urine or their hair, and you want to make sure that you check out what's going on there, make sure that it's clean and healthy, and it could be a sign of a different of an underlying injury if you see a pattern of buildup in their groin area. And then, of course, you never want to bathe your bunny. If your bunny does get soiled somehow, sometimes they do, you can take a damp washcloth or an unscented baby wipe to wipe that off. You don't want to bathe your bunny because they can go into shock. You know, they do have some videos circulating out there on social media with bunnies like sitting in a bathtub or in a sink, and it looks like they're relaxing, but actually they're in shock and they're very stressed out. So you don't want to put your bunny through that, please. They are a little bit like cats in that they can groom themselves for the most part. They just need our help for these few things. Okay, next slide. All of this grooming is giving me a little bit of an allergy situation. Okay, so before we go into at-home health checks, we want to talk about rabbit hemorrhagic disease virus because this is going to influence kind of how you care for your rabbit. So rabbit hemorrhagic disease virus is a highly contagious disease caused by a calicivirus. Now, the calicivirus is a very resilient type of virus. It has nothing to do with characters from Game of Thrones, but it is very hardy. So until 2020, actually spring of 2020, there really hadn't been much of a concern in the Western United States. But we did have an outbreak that has swept through the Southwest and is now in Southern California and has been moving east actually throughout the United States. This is specifically an outbreak of the rabbit hemorrhagic disease virus strain 2. And it is something that we have to be very attentive to because it can spread between the wild hare population and domestic rabbits. They are different species, so not all illnesses can be spread between the two, but this one can, and it is highly contagious. So symptoms you're going to want to look out for will include loss of appetite, lethargy, a high fever. Again, know your rabbit's ear temperature, something more visible like a seizure or jaundice. And then bleeding from the nose, mouth, or rectum is how the illness gets its name, rabbit hemorrhagic disease. And then another symptom is difficulty breathing. So you might see your bunny breathing very rapidly, or they might be breathing through their mouth. And when rabbits breathe through their mouths, that is a big red flag, and you want to contact your vet right away, regardless of any other symptoms. Also, sudden death. So a lot of people won't even know that their rabbit has RHDV2 until they've passed away. They might not even see any of these other symptoms. So it's really important if you or someone you know has a rabbit who dies suddenly, that you report that to a rabbit savvy vet so that they're able to report that to the state and make sure that they're tracking the outbreak. How is it spread? So we've said that it's very contagious. And being contagious and spreadable are not exactly the same things. So we'll talk about ways that it's spread. So you can spread RHDV2 through, these very traditional or expected ways of, coming in contact with an infected animal or contact with their droppings, like an infected rabbit's feces or their urine. And rabbits can contract this disease through insect bites. So it's really important to make sure that your rabbit has a prescription to a rabbit-safe flea treatment to repel fleas and kill them if they come in contact with your rabbit. Talk to your vet about that. Most likely they will prescribe you something like Revolution that is safe for rabbits. You don't want to give your rabbits anything that's not formulated for their species, and that would include Frontline. You don't want to use Frontline. Other ways that this can spread that make it especially easy to spread is that RHDV2 can spread through inanimate objects, or what are called fomites. So if you were to have, say, one of your rabbit's toys came in contact with an infected rabbit, or with their urine or feces, or if you were to handle an infected rabbit and then come home and handle their toys or their water bowl, etc., you could spread the disease to them that way. They can also be infected by ingesting contaminated food or water. And humans, we can track the virus into our rabbit through, if we were to come in contact with their droppings on maybe on our shoes or our clothes, or if, say, a predatory bird were to find an infected rabbit, and then in their droppings, they would spread the disease. And so we need to be careful really about anything that we might come in contact with outside that could have come in contact with a wild rabbit. So if you have a wild rabbit population in your area, you do want to be extra cautious. Next slide, please. So the best ways to protect your rabbit is to house them exclusively indoors and to get them vaccinated. But there are some biosecurity measures that the National House Rabbit Society and SDHRS recommend for stronger protection. So again, washing your hands before and after handling rabbits, any other animals, or their food and water bowls. And this includes rabbits who you know have been vaccinated. And that's because the vaccine that's available has an efficacy of about 85%, which in the world of vaccines is pretty strong. But considering the effects that the illness can have on your rabbit, you do want to take these extra precautions. All right, another tip is to leave your shoes outside so you don't track the virus in. Change your clothes when you get home if you've been outdoors. Maybe if you go to a dog park, or you're in an office with people who have dogs or other animals. Disinfect items that may be contaminated, including your clothes. You can wash your clothes twice with hot water if you're concerned that they've been contaminated. It's a good idea to wash your clothes with hot water if they may be contaminated anyway. And then don't feed your rabbits foraged greens from an outbreak area. So that means if you're in an outbreak area, so in the Western United States, or in one of the states that has an outbreak currently, you don't want to feed them from your garden. And that's because it's a lot more likely that your neighborhood cats or birds are going to be able to get into your garden, leave their droppings, etc. And then the greens that you do feed your rabbit, you want to make sure that you rinse them thoroughly. They recommend at the National House Rabbit Society that we wash our greens for about 2 minutes and make sure that you agitate them well, and replace the water, refresh the water as you rinse. Next slide, please. And we have a couple more here. So if you do have cats or dogs who live indoor, outdoor, and they come into your home, provide a separate living area for your rabbit so that you don't have to worry about, always having to follow like every step that your dog takes and disinfecting the floor after them. If you provide them a separate room, or you're able to block off an area so that they're not tracking in from outdoors, you want to do that. And anytime that they come in from outdoors, it's a good idea to wash their paws. Then you can use a monthly flea treatment formulated for rabbits, like we've already discussed. And then if you're bringing in new rabbits and they've either had time living outdoors, or you're not sure if they've been vaccinated, it's a good idea to quarantine them in a separate area of your home for at least 14 days to ensure that they do not have an infection. The best disinfectant that we've found, the most effective and safest disinfectant for animals that we've found, is one formulated with accelerated hydrogen peroxide. It's not regular hydrogen peroxide. It's a special formula, and the brand name is called Rescue. And a little perk of rescue is not only does it kill the highly resilient RHDV2, the virus that causes RHDV2, but it also kills coronaviruses. And it should be noted that RHDV2 is not at all related to the coronavirus that causes COVID-19. Okay, next slide, please. Okay, so getting your rabbits vaccinated. As we've noted, there is a vaccine available in areas where there has been an outbreak and the vaccine has been authorized. So it's been used much more extensively in other parts of the world where they've had more long-standing outbreaks, and it's still new to the United States. But at least here in the San Diego area and in a lot of other communities on the Pacific Coast, like in Washington and Oregon, it is also newly available as the outbreak spreads. Here in San Diego, you can contact SDHRS for a rabbit savvy vet who does offer the vaccines. We're in close contact with them. And then you can also learn more about RHDV2 and the latest updates at the National House Rabbit Society website, rabbit.org/RHDV. And they're doing a great job of tracking outbreaks and the latest recommendations. Okay, next slide, please. Okay, so now we're going to talk about the fun stuff. Although I don't know if this is as fun as getting to handle your rabbit, which is next. So let's do some at-home health checks. So we've already groomed our rabbits and they're being somewhat patient with us. So now is a good time to do a little bit of a health check. And what we're gonna do is we're just gonna check their skin for any lumps or bumps, cuts, bites. Check their hair to make sure that they're not getting too much sun exposure sitting next to their favorite window. That can cause some bleaching and then irritation with their stiff hair. And then look at their chin. If they've got wet hair and that's a pattern, it could be something as simple as maybe they just don't clean their face after they drink water, but it could be a sign of a dental infection, drooling, maybe some dental pain, so it's harder for them to swallow, stuff like that. Also check for matted fur like we've talked about, which is a great thing to do while you're grooming. And then also, as we mentioned, you want to check their eyes and ears and their nose. You will look for, excuse me, at their paws. If they have any sort of yellow buildup, that can be from nasal discharge, and it can be a sign that they're kind of wiping their nose, and they could have a respiratory infection or a sinus infection. All right, then parasites. You can check for parasites or larvae, ticks, fleas, or droppings as you're petting them, as you're grooming them, and check for their overall body composition. So do they seem bonier? Do they seem plumper? Do they seem dehydrated? You can usually feel if their skin is very tight. And then keep an eye on their breathing, whether it seems labored, quick. Sometimes if you're holding them, they're going to breathe a little bit faster. But then notice after you let them go back to their favorite place in the house and they're calm, what's their breathing like? And then each week, you just want to check for any sort of buildup in their ears from wax or lumps at the base of their ears, maybe sores. If you are able to kind of lift them up and check underneath them, you want to check for sore hocks, which is going to be raw skin on their little paws because they don't have paw pads like some other species. So it's a little bit more prone to sensitivity. And then check for genital irritation, such as buildup that has kind of gotten too heavy or caught on things and it's causing their genitals to be irritated, or urine scald, which is when urine builds up and it's just a lot of constant dampness and their skin gets raw and irritated. And then check for uneven wear and or overgrowth on their teeth. And it can be hard to look at your bunny's teeth. So I like to start by just gently pressing along their jaw for sensitivity, if it seems like there's some sensitivity, you can just gently lift back on their lip for a look. If you are concerned, you can always just ask your vet about it. And you want to make sure that you schedule a yearly wellness exam with a rabbit savvy exotic veterinarian and keep it, even if it's like once or twice a year. It's really important that your bunny gets those check-ins because they can live anywhere from 8 to 12 years. And then as your bunny gets older, usually around the 5 or 6 year mark, your rabbit vet will likely recommend that you schedule regular blood work and molar checks. Usually, instead of once a year, that'll probably shift to twice a year. And you really want to take them up on this recommendation because, as your rabbit gets older and they're in their senior years, they often need a little bit more medical support. Next slide, please. Okay, so we did say we're going to do a little bit of a health check here. I'm actually going to take you through what we call an illness protocol. So this is something that's built out to help you in those times when you're not sure. Maybe your bunny is sick, they're acting a little bit differently, you're observing some changes in their behavior or in their eating. So you want to see, okay, how do we tell what kind of care they need? So the first step is to offer them a treat. And this can be a piece of their favorite salad. It can be like one of those little biscuits or a hay cube, something that they normally would eat that, something's wrong if they refuse it. So you start with the treat. If they refuse their treat, you're going to continue to step 2, which is check your bunny's temperature. Now, checking their temperature formally does involve a flexible rectal thermometer and a little bit of petroleum jelly and a very patient but probably nervous rabbit. So I recommend that you learn how to take your rabbit's temperature, yes, but also that you're aware of what their ears feel like so that you can tell if their temperature is high or their temperature is low. Now, Dr. Bernal during Bunny 201 gave a great session on kind of your at-home emergency kit, some more in-depth at-home health checks. So you might even want to go register for that recording and watch that session as well if you have any specific concerns. So if it seems like your rabbit's temperature is abnormal, then you want to make an emergency vet visit. So call your vet if your rabbit has a low body temp or a fever. If not, you can also treat them for potential gas pain. And one of the things that you might want to have on hand are going to be rabbit safe gas drops. And that's going to be simethicone. And talk to your vet before you have an emergency about proper dosage and if that's something that they would recommend for your rabbit. You don't want to give your rabbit anything that is not okay with your vet. But if they do okay some gas drops, that can usually help you determine if your rabbit has a solid blockage or if they're not feeling well because they just have some gas pain. It's really important if your rabbit is not eating that you take care of that as quickly as possible. And then you want to make a vet visit to determine the root cause of whatever is causing them to act abnormally. So make sure that you make that vet visit. If you do need to make an emergency vet visit, so things are not resolving at home, it's important to know where the nearest emergency veterinary care provider is. In the San Diego area, we have the the Pet Emergency and Specialty Center. And there's one location in La Mesa and there's one location in Chula Vista in the South Bay. So whichever one is closest to you, it's really important that you know, because sometimes rabbits will have health problems or medical emergencies off hours. Okay, next slide, please. Okay, so we talked a little bit about your rabbit not eating or having a blockage, and that is called GI stasis. So that is a symptom and a condition that's very common in rabbits because they have very sensitive digestive systems. And this can come from a lot of different causes. Often it's from an inappropriate diet that's too rich, so maybe it doesn't have enough hay to offset other rich elements in their diet, like too many pellets or the wrong kind of pellets. But it can also be caused by a number of mental health issues or other illnesses or injuries. So like stress, pain, depression, dehydration, any sorts of just incidences that might cause your bunny to not feel well that can affect their digestive system. So here's a few signs. So a change in their poop shape and frequency, or in their eating frequency, or maybe they don't eat at all. Also, their posture and their body language is going to change. One of the earliest signs of GI stasis is if your rabbit is really having a hard time getting comfortable. So they might actually just press their tummy on the floor. They might lie down, get back up, lie down in another position because they just can't get comfortable. They might also grind their teeth or feel or look withdrawn and kind of lethargic. So those are things to look for too. Really, any sort of negative change in your rabbit's behavior should prompt you to look at their digestive health. Next slide, please. Okay, so we're gonna do the fun part. So we're gonna go ahead and pause, and I'm going to go get an assistant. You probably won't even notice that we're gone. I'll be right back. All right, we're back. I know I look a little different. Actually, this is Anna, my very sweet patient assistant. So this is the fun part. We're gonna talk about handling your rabbit. Now, it's important to remember that rabbits don't normally like to be picked up. You can tell Anna's already a little nervous about this. They don't like to be picked up because they're prey animals, but you may need to handle them, like to take them to the vet or to the groomer. So it's important that you know how to do so safely. So you want to approach your rabbit from above their head and pet them to calm them down. So in most cases, if you're not in an emergency, there's no rush. Okay, pet them gently to show them that they're safe and to offer some affection. I'm going to turn you sideways, Anna, so that we can see. All right. Now I'm right-handed. So what you're going to do is put your hand underneath your bunny's rib cage and their arms here so that that's secure. And then you're gonna scoop them up underneath their hindquarters. The lighting isn't great. We can actually go to the next slide. That might help too. So you can see some different holds. So you'll see that's what we're doing here. The hold number 1. This is much more secure. If it feels like your rabbit is going to struggle and get away, you can always just hug them a little bit closer. If they are gonna really get away, you just wanna lower down closer to the floor. In fact, I recommend if you're new to handling your rabbit, that you go ahead and sit on the floor with them while you're handling them for the first time. Okay, there you go, Anna. Nice girl. Now we're gonna do hold number 2. And hold number 2 is really great when you're just trying to lift them out of a carrier or like to put them on the exam table for their vet visit. You'll notice that it does make the rabbit feel a little bit more vulnerable. You'll see how that was super quick. You can do that again. Yeah, scoop her up here. And instead of twisting her toward my body, I twist her out. She does feel a little bit more vulnerable because her feet are out here, her face is out here. So this isn't a really good long-term hold, but it's pretty secure and it's easy. All right. Okay, are you ready to do hold number 3, Anna? Okay, so hold number 3. Okay, so hold number 3, let's start here on the ground. Scoop her up, and then we're just gonna turn her in more of a lateral move. See, and you'll notice Anna's a little nervous, so I'm keeping my hand pretty firmly on her underside and around her arms. Some rabbits like to tuck their chin, their little nose in, like that, you'll see. If your bunny seems really agitated, you do want to be careful with this one though, because they could jump off of your arm like a springboard. And then finally, hold number 4, we do want you to be very cautious about because there is the potential of trancing your rabbit, which is when your rabbit's head goes lower than their feet. And they do kind of go into a state of shock. They're unresponsive. And that's usually because they're scared. So we don't ever want to trance our rabbit. There might be some situations where your rabbit does need to go on their back though, and that is going to be maybe when they're being groomed. So let's do that also. You ready, Anna? I know you don't love this. But see, you're gonna scoop up, and then you're just gonna roll her very gently. Keep her facing up. Roll her very gently. And then when it's time to let her go down, you do wanna make sure that you're holding her very securely. You don't wanna just open up and move your hand. You just wanna roll her back down onto a safe, secure surface so that she feels pretty safe. There you go. Good job, Anna. You never want to lift your bunny by their ears or by the scruff of their neck. Always supporting their torso and their hindquarters. Okay, next slide. Thank you so much for joining us. Anna says thank you to everybody for joining us for Bunny 101 for the last episode. And I hope that today you'll catch more sessions. We have 1 day left, including bunny bonding basics. And also, all of the previous sessions that were already hosted this week are available if you register for the recording. So if you've missed anything, it's not too late. Have a great day.